Kidney releases or secretes a hormone called erythropoietin. This erythropoietin helps in the production of red blood cells, which is erythrocytes. Primarily, your kidney as an adult helps in the production of hemoglobin, which is the erythrocyte, red blood cells. Okay, without production of red blood cells, you and I can't be alive. But majorly in the liver is produced for children and the rest. As they grow up, the kidney takes virtually all the functions. Yeah, good evening all. I'm here once again to bring you health tips. If this is your first time of being in this platform, this is a very prestigious platform that comprises of a lot of ideas we share here, and we analyze events as it is all over the world, and also especially we bring you health education on how you could manage your health, you could take good care of your health and avoid diseases and infections. So all these are things we bring to you freely in this platform. So today, before we begin, my name once again is Fortune Okochukwu, and I'm here to bring you on a topic that says know your kidney and eat health. Know your kidney and eat health. So let's begin. Welcome back. What is kidney? A lot of people have heard about the word kidney and they don't even know the function of this kidney or where it lies or what the kidney generally do in the body system. So today you will know what the kidney is, how it looks like, what its function is, and how you can manage or care for them. They are very vital organs in the body as God has designed it. Now the kidney, as per definition, grossly, this is a bean-like shape, reddish brown organ located in the retropectoral axis of your back. This is your back. I will try to use a layman understanding language for you to grab, because if I start using the big words you might get lost. This is not why we're here to making sure that you grab everything. Now the kidney, what I mean by retropectoral is it lies just beneath your rib cage here and protected by your spine. The last part where you can feel your rib last, you just lie beneath it. Okay, and protected by your ribs and your spine. It's a very vital organ that you cannot do without. Every human being, we can't do without our kidneys. But we can do without one, but not without the two. You can actually survive with one kidney and the other one keep moving, carrying the body along. Most people in the population, even they are living with just one kidney, but most of them don't know. And that is why you should constantly, at all time, at least go for asymptomatic screening. Go to hospital to run tests. Let the doctors examine you. Let your healthcare providers examine you and tell you what is wrong with your body. These are people that have been trained in different disciplines, okay, different specialty per se in medicine, that knows your body physiology and its recommendation as per what they present that moment. So feel free at any time, walk up to any clinic, good clinic, go for tests. Tell them we want complete medical test, and your doctor will advise you. Now let's go back. The kidney, as we all know, as we just said, you know where it lies now. where there are two and everything, they are there. So also know that the left kidney lies more superior than the right one because of the space of the liver on the right part. So the liver tends to, occupy much space from the right part. So the left one is more like this. So they are balanced like this. The two kidneys are not always same. So one is like this. Okay. Now they connect down to the bladder, having filtered your urine and everything, connect down to bladder called ureter. Okay. Now before they empty inside the bladder, there are a lot of functions this kidney, this vital organ does. Okay, like I said, without them you cannot live. Now we're going to know the functions of these vital organs. The primary function is just to filter your blood, to make sure that they are pure. Your blood is pure. That is the primary function of the kidney. Continuation of filtration of your blood, GFR. That is their major functions. There are other functions they do, but the major ones is filter your blood, make it pure for the entire body system to make use of. Now, how do they do this? Kidney cannot just come and start filtering your blood, maintaining it and everything. No, they require a lot of things, and also your help as well. They require your assistant as well. That is why you should make sure you liaise well with your kidneys at all times. Give your kidney what they require. The moment you stop giving your kidney, or your body stop giving your kidney what they require, they go pack. And once they pack, you say go pack, go, God forbid. I know somebody will say God forbid. Now, number one function, I will generalize the number one function. Let's start from there. One is regulation of what? Blood pressure. Once your kidney fails to regulate your blood pressure, definitely it will affect other parts of the body system, which will be very fatal. How do your kidney regulate the blood pressure? Sorry to say. One, this kidney now release an enzyme called renin. This renin now acts on the angiotensinogen in the liver, which converts angiotensinogen 2, which will now be later converted also in the lungs to angiotensin 1. This angiotensin 1 is a vasoconstrictor. What do I mean by vasoconstrictor? I mean it constricts vessels, blood vessels, make them tiny. And once it constricts the blood vessels, definitely the pressure will increase as the body desires. Okay. Now, your body system must align with the kidney functions. If it doesn't align with the kidney function, the kidney will fail. And that will bring us to what we call erythropoiesis, one of its function again. The kidney releases or secretes a hormone called erythropoietin. This erythropoietin helps in the production of red blood cells, which is erythrocytes. Primarily, your kidney as an adult helps in the production of hemoglobin, which is the erythrocyte, red blood cells. Okay, without production of red blood cells, you and I can't be alive. But majorly in the liver is produced for children and the rest. As they grow up, the kidney takes virtually all the functions. That is why you see cases of renal failure, they look anemic, very weak and the rest. Okay, because the kidney is no longer producing red blood cell, or even if it's producing it, is not sufficient enough to carry other visceral organs or the entire system. Another function that the kidney does in your body is regulation of electrolytes in the body. These electrolytes are needed in the body for proper filtration of blood. It balances them. It has to do with the sodium potassium balance. It must balance well. If one is higher than the other, there will be a problem. You see, the kidney works so vigorously every day and night to keep you alive. Your sodium potassium must balance well. There must be okay. No, this one will go high past this one, this one go high past. It will be proper. Okay. Now, another major function is regulation of what? pH level. That is acidity or alkalinity of your body. Between 7.35 to 7.45. It must be within this range. Else, there will be a problem. As the case may be, the kidney must excrete more acid out of the body or retain them as the body needs them. There will be a time the body needs to retain, reabsorb, or excrete more. Okay? Now, controlling of water balance. The body needs a lot of water to making sure that the kidney filters the blood well. The kidney cannot undergo filtration without water. There will be a time in the body in the body system whereby the kidney need to even reabsorb them back in the circulation. The case of dehydration and the rest. So the kidney need to reabsorb some blood in the tubules of the kidney. It will reabsorb water or to making sure that it filters toxins out. Without water, it cannot balance the acid base itself. They cannot mix well. So the kidney must make use of what? Water. So the more you take water, the more urine formation, the more kidney filters everything and makes your urine clear and everything will be okay. Your blood will be more pure. So you need more water. So it depends now on the kidney, the amount of water it will absorb. So if you take 50 gallons of water, which I know is not possible. Take 50 gallons, for example, take 50 gallons of water. It not necessarily mean that those 50 gallons of water are the ones that the kidney will use. The kidney will take the desired parameter and excrete the rest or reabsorb them, depending on the nature of the body, what you are facing at that moment. If you are facing dehydration, definitely the body will need more water. Okay? Now, there is another major function of your kidney, which is what? Production of vitamin D. Okay? The kidney makes use of calciferol, that is calcitriol, I mean to say, to convert or metabolize vitamin D, to making sure that your vitamin D is maintained in your body for calcium. Without calcium, also you cannot be okay. You need calcium for strong bones. You need calcium for healthy life. Now, as we speak, in your kidney, which is majorly divided into two, the outer cortex and inner medulla. The cortex is the one you can see grossly like this. You see everything, the shape, the color, all those kind of things. But the main thing, the inside is the medulla, which houses the glomerulus, the nephron, the pyramid down, everything. Okay, now nephron is the main functional part of the kidney, which houses the glomerulus, and these glomerulus have glomeruli connected with what? Renal pelvis. They do the filtration, everything, the urine is formed. Urine is toxic, is not needed in your body system, and that is why your kidney must, excrete them out. Uric acid is there, excess creatinine is there, uric acid and everything. Body doesn't need it. That breakdown of proteins and the rest should be out. Now, you now know the major functions of your what? Kidney, which is blood pressure regulation, maintenance of acid-base balance, electrolytes, water balance, blood pressure, erythropoiesis, and vitamin D production. Now we know all these things now that the kidney does. How do you take good care of your kidney to making sure that these functions are maintained continuously? Because it's not easy. Number one, hydration. Constant hydration. Making sure that you are hydrated at all times. What do I mean by hydration? Drinking of enough water. Hydrate yourself. Drink, as I see, drinking of enough water. Without water, your kidneys can't function. They will shut down. Extreme hydration will crash the kidney. Make sure you drink at least 2 to 3 liters a day of water. It will filter your blood, because the kidney is major function is to filter out toxins, waste products, breakdown of metabolism, things that your body don't want. These are the functions of your kidney. It's to remove it and form all of them as urine for you to pee out. You understand? Please hydrate yourself. Drink much of water. Healthy lifestyle by avoidance of what? Extreme alcoholism, smoking as well. Treat lung infections. Okay, you must treat infection, whether viral infection, whether bacterial infection, fungal infection, anyone you must treat. Long-term untreated infection can affect your kidney. So you need to constantly go for what? Checkups. So when you go for checkup, don't wait until something happened to you before you be rushed to the hospital. Doctors are not gods. They are not angels that will just bring you back to life. Sometimes they think they tire doctors. If for their mind, some of them just you will die. Say, this one go, sorry about that, but sometimes because they are not gods. Come when you are at least there is life in you. You can be helped. Okay? Something can be done. Not be when the kidney don't pack, finish, nothing. Nobody go fit do anything. So please go for screening. Go for screening. Okay? When you go for checkups, there is what we call renal function test. It will be done either with your urine or your blood. They'll be able to check all the parameters. Okay? Uric acid level, creatinine level, a lot, electrolytes balance, everything. They will check everything. If there's anything the doctor or your healthcare provider will advise you to, if you don't go for screening, nobody will know what is wrong with you. So investigation is very important. Screening, asymptomatic screening is very important. Okay. Another thing is avoid excess intake of salt. Excess intake of salt damages the kidney. It helps to form crystals. Okay, this might also lead to kidney stones and the rest. So, salt is also a mineral and the rest. So, the more you take them, likely they will form crystals. Okay, and it will increase blood pressure also. Excess intake of salt is not good. Minimize your salt intake. At least if you can do without salt, good. But your body also cannot do without salt. You need little. If you are, for example, now you are cooking rice and stew, and you know that in that stew you've put little salt, don't go and cook the rice and add salt. Say, this rice, you don't put them for it's there. Same amount that your body needs that is already in the stew is what your body needs. So not be the one waiting for rice, waiting for stew will give you everything. Watch how you take high salt levels. Okay. Watch your blood pressure. Okay, always check your blood pressure, because the kidney receive between 20 to 25% of total cardiac output. As the heart is pumping out blood through the left ventricle and everything, they are going down to the circulation. The first organ that receives the highest output is the kidney through the renal arteries. You see, if you measure the pressure, the TMP is high, the transmembrane pressure is always high, because they have to lodge into the kidney for filtration and everything. So now, once the blood pressure is higher than normal, maybe 145, 150 over 90, 100 millimeter mercury, it can damage some kidney nephrons. And once the kidney nephrons are damaged, it's a problem. This is the functional unit of the kidney itself. Filtration will be impaired. And once the filtration is impaired, there's nothing anybody can do. The kidney will pack and go. So now, watch your blood pressure, regulate it. If you are under drugs to regulating blood pressure as prescribed by your doctor, please stick to it. Stick to it. If you must change, seek advice from your doctor first. Another thing you can do to maintain your kidney is exercise. Regular exercise. At least 30 minutes daily is good. Some of you sit in the office just like this for hours without even standing up and walking. Your occupational health and safety is at risk. Okay, because once you sit down like this, most of your venal valves are almost closed. Okay, so but once you stand up and move, walk, you see, venous pulling and the rest occurs. It helps in the circulation of blood. But if you help yourself more by after walk, you go out for exercising or a little bit long distance trek, it helps a lot for circulation. Please also avoid smoking. Smoke contains carbon dioxide and tar, nicotine. Tar is a carcinogen, is a cancer-causing agent that your body don't even not to talk of your kidney. It will damage your kidney or impair their function. Okay? Do not take smoke at all. Do not take smoke. Then the caffeine in it is what? A stimulant. So the more you take smoke, the more you trigger your heart rate to increase abnormal, because the caffeine will always increase your heart rate at all time. Then another way you can help your kidney is if you can even avoid caffeine-like substances, it will be good for you. This is especially for people in the office that can't do without caffeine. Coffee all the time. Coffee. If you can't quit it, good for you. I'm telling you, it contains primary what? Caffeine. Go and read the effect of caffeine on your kidney or your heart. You will run from it. I'm not saying caffeine is bad, but little of it, but not dependent on daily basis. Okay, not dependent on daily basis. Then avoid excess calorie intake is not good. Food that contains high calories, fatty foods are not good for you. Because why? Food that contains fat or lead or high in calories, they go and what? Impair your heart functions, reduce the functionality of your heart, and once your heart is their function is your heart function is reduced, definitely the cardiac output that your kidney needs to work to do the filtration, the kidney will not get it. Okay, because all these fat-like food substances can lead to what? Blood pressure or arteriosclerosis, blockage of the arterial walls. So you go narrow the blood vessels, the arterial walls, they no go fit enough blood wey suppose pass, no go fit pass. So you will see fat-like food for the walls will narrow am. So now it will now push the heart to stretch themselves, it stretch itself to pump more blood. So in that now the heart might get exhausted or high rate. So once the kidney transmembrane pressure is higher than normal, nephron is always the target, the damage. Please maintain healthy food. Okay, eat well, healthy food, more of vegetables, more of fruits, because if you eat more fruit, if you eat fruits well, vegetables, okay, they have that antioxidant in them to detoxify wastes, accumulated waste on the vessels. It helps to cleanse your blood also. So it will help the kidney to do less job. Okay? To eat well, healthy lifestyle matters a lot. Eat well, quit smoking, quit alcoholism. It has been recorded that about 45% of people that dies of kidney failure have had high alcoholism intake. Quit alcohol, quit alcohol, quit alcohol, quit smoking. Check your blood pressure very well, hydrate yourself, eat fine, exercise, eat less of salt. If possible, if you can avoid it, better. Drink plenty water. Then do regular checks. Go for checkups. Then also treat any underlying infection you have. Be it viral infection, be it bacteria, fungal infection, name it, go and treat it. Don't leave it. Don't say no. Because once there is any disease in your body, believe you me, it must affect the kidney, because all those blood they go inside the kidney and they will attack it. Once they attack it, class is finished. And also checking of blood glucose level. If you are diabetic, please try your best to what? Maintain blood sugar level. Check your sugar level always. Check your diabetes is one of the major things that leads also to what? Kidney failure. Okay? Inability of your body system. This is autoimmune now. Inability of your body system to metabolize what? Glucose. And once they are not able to metabolize glucose, they are high. All of them inside kidneys. So they will pass always. They will be there. Please. Blood glucose level. Eat less of carbohydrates. Minimize it. That is a good ration is necessary always. Balance your food. Fruits, water, mineral, fat soluble foods with carbohydrate, protein, little of it and everything. You drink plenty of water, colors. That's all your body needs. So if you call they pack things, there will be a time your body will reject it. And sometimes if they reject it, they don't see anyhow the way they go take excrete them, it will start fighting what? Your body. So my brothers and sisters, as you do this, you will see that you will live long. Your kidneys will stay fine and it will serve you. Okay? Please, next video I'll be talking about the diseases associated with what? The kidney diseases. So you know several kidney diseases as a result of not managing your kidney or taking care of it. So stay with me. Remember to subscribe to our YouTube channel. Share this video. Share it so that it get to people. People will be educated as you are educated. Thank you and God bless.